I really wanted to ignore this. I didn't want to go over this video because I don't like going over documentaries, because I like responding to arguments, and most of the argument in documentaries like this is just carefully controlled and edited musical and sort of framing decisions that are meant to emotionally manipulate you. There's very little in the way of actual arguments. You could film a documentary about a person being sad about, and like literally any subject. Like you could find a guy who's just apoplectic about the end of slavery 150 years ago. And you could have like the sad music and stuff, and then you could be sitting there for like 2 minutes while this guy's like choking out sobs about like back in the day he could have done so much more if he had free labor or something. And I just have to be like waiting for I'm gonna debunk the sad music they're playing or something. So I didn't want to go over it. I got bored after a minute, but then PragerU bought out a $1 million ad buy on Twitter, put it to the top of everyone's recommended feed. It was right there in the search thing, like look up local stuff, like search. There you go, PragerU. That Twitter is worth about $5 and is desperate for any ad, any advertisement revenue it can get. Unsurprisingly, conservative orgs are taking advantage of this with relatively cheap ad buys, getting to the top of the like Twitter recommendation algorithm for a whole day. I think for only $1 million, that's incredibly cheap. That's a bargain. That's insanely cheap. I imagine Twitter, was probably more willing to take it because Elon Musk hates trans people, so I don't know. D-Trans: The Dangers of Gender-Affirming Care. The 21-minute film focuses on two people who have detransitioned, meaning they were previously identified as trans and later decided they were not. Nice. Now, normally I would bury the lead on this. Normally I would wait till the end when it would be funniest to put this forward, but in this case I feel like I can't because A, I might forget, B, I don't know how long I'm going to go, and C, it is very necessary context to go into this, okay? Because apparently one of the detransitioners that will be focused on in the video we're about to go over is still dysphoric and is simply repressing it with, quote, Jesus Christ. From Daisy Strongen: I don't want people to think that just because I've detransitioned and chosen a more traditional path, I'm now cured. I still deal with self-loathing. I'm still sick of being me. I'm still depressed. I'm still a miserable, wretched sinner. The mental ailments that lead me to transition still plague me today. I still fantasize about being a guy at least a few times a week. I'm often a guy in my dreams. Jesus Christ. But now I know that I can't indulge in these fantasies. I have to be the best mother/wife I can be. Jesus Christ, my only hope. He's your only hope too. She seems happy. So, yeah, just right off the bat, here you go. So this is a trans man who is desperately suppressing that with religious trauma. I'm sorry. Yeah, she with the biggest quotation marks imaginable. This is essentially somebody who has been psychologically tortured into not believing that they are trans. I don't have to respect that. I don't respect that. This person sounds miserable and I feel very bad for them. At the same time, they are participating in a conservative hate movement against, well, them and trans people broadly. So that's not good. Yeah, this isn't even like an egg or egg cracking or whatever. This is like gathering a full-on omelet and sobbing while you try to cram it back into the eggshell you fished out of the trash. This is miserable. And with this wonderful precursor, D-Trans from PragerU, a short documentary.
Courage. Here, boy. Come here, Courage. There you are. See, this is Courage, and he's going to pull me through. Okay, Courage. Okay. Pull me, Courage. Pull.
So we begin by looking at videos of yourself when you're young.
Pull.
Is this too loud?
I really am sad that I took my voice for granted. I didn't just take it for granted. I hated it. And now, I would do anything to have that voice again.
You were 5 in those videos. Your voice is supposed to change in between being a child and being an adult. Your voice sounds totally normal. For a cis woman, your voice sounds fine. Okay.
Now it's your turn to teach me.
Why is that so loud to me? Oh my god. Get out of my face, kid.
What's funny, Daisy? Come back out with me later, okay? Say hi, Mom. Our goal here is to offer gender-affirming therapy.
There is a substantial body of research that shows these treatments
Treatment
work.
for gender dysphoria is...
Hey, I know this individual. What's up? Naomi spotted. Hello. Be real, their voice has obviously been masculinized from T. Dude, no, I've literally heard tons of cis women who have that. Like, maybe it was, but the idea that, you know, they have some, like, ruined masculinized voice, whatever, is total bullshit. Like, yeah. Okay, just to, like, put a frame around this, just to, like, start building the frame, okay? There is nothing wrong with being a detransitioner, okay? So, first of all, if you believe you are trans and you want to seek some kind of social or medical remedy to any concerns you might have about your body or identity, that's based in red pilled. God is on my side. I have been doing this for years now, and I have never lost on a single point on any argument to anything related to trans people, indirectly or directly to any conservative. I have an undefeated, completely, like, flawless chain of victories on the subject. I don't even care to argue about it anymore. To embrace the validity of trans people is to embrace God. There is no point in even, like, to suggest anything else is a waste of time. With regards to detransitioners, many detransitioners, in fact, most of them, detransition for reasons that aren't associated with their identity. The two largest ones being they no longer have the money to transition because, you know, medical costs. That's one. And two, because of the social pressure they face, as in they get bullied into not transitioning. As for detransitioners who detransition because they legitimately have a turnabout on their identity, like they were born a guy, but then they trans to a girl, and then they're like, oh, actually, never mind, I'm a guy again. For people in that position, that's fine. Do whatever you want. That's fine. That's okay. Do whatever you want. That's cool. The only thing that negatively disposes me towards detransitioners is the incredibly small minority of them that get paid by conservative movements to attack their brothers and sisters. I think that's pretty cringe and blue-pilled. Now, again, very often these detransitioners are in a state of extreme mental anguish themselves, as is clearly the case with the individual we're going to be spending some time with in this documentary. Like, God help them. And a lot of them are directly approached by conservative movements who are cynically looking for some money to make. A good example of this would be Oliver London. Is that his name? Ollie London? The name of the guy who wanted to be Korean, like a Korean girl, but then he changed his mind or whatever. That guy is a lunatic. He's mentally ill. Conservatives at some point were like, hey, you know, we could make some, you know, we could, you know, maybe sort of weaponize this guy in the war against progressivism. They handed him a bunch of money and he just became like a hardline advocate against trans people. He doesn't believe any of it. He's just getting that bag, but you know, whatever. Anyway, yeah, I just want to make it clear. We are not an anti-detrans channel. This is not an anti-detrans segment. This is an anti-Prager U segment. Yeah, a lot of them are being groomed. Yeah, 100%. Like, this is grooming. This is grooming.
to be life-saving medical care.
It really comes down to how uncomfortable with their body parts.
Deciding to permanently alter the bodies
And do
of
they want to
children.
change those body parts?
What do their doctors know?
Wouldn't you want to be a woman too, Canoe?
Nobody.
No.
Enough children have already been victimized by this barbaric pseudoscience.
Ridiculous.
My childhood was ruined. This needs to stop.
We have a serious problem.
I had an alter ego.
Okay, so sorry, so far literally no arguments from the opposition. I'm not gonna keep saying the whole like this is just scary music, you know, propaganda, whatever. If you want to like show this video to people, you know, who like the PragerU thing, who are curious about the detrans thing, I'll try my best to be constructive. I'm not gonna keep saying over and over like this is just stupid low IQ propaganda meant to jump scare people into being reactionaries. But that's what it is. I hope you do, DM. You probably got a lot more to say in it than I do.
And he was like this boy that I like customized in my mind of like the ideal boy. Other girls looked
That's basically
so different than I did. They were, you know, expressing themselves very differently.
Hey guys, so for today...
I was depressed, hopeless, and I was feeling pretty dejected and scared and alone. I didn't like life. Like, I just wanted to stay in my room all day.
Wow, they are really going they're really going full tilt with the I'm a girl circled. Very normal, very normal thing. Okay. Yeah, if I feel like if I stop to like make fun of all the propaganda, this is going to go on for 6 hours. So I'm going to try and engage in a little bit of self-control here, which is difficult for me because I normally don't. Being depressed and having identity issues, very common for trans people who haven't transitioned or who haven't realized it yet.
As you spiral into depression, it really feels like you're in a hole that is so infinitely deep, and the depression just was really debilitating in that I didn't really care about
Self-worth, it's not a real thing.
improving myself because I already felt like I was just like I shouldn't have been born. Just having really like dark thoughts. I always just felt
That's also a really common sentiment for depressed people. The idea that you hate yourself so much that you don't put any effort into self-improvement. This is one of the reasons why I think that guilt is like the least productive, most worthless emotion that humans can feel. If you've done something bad, do something to account for it. Guilt doesn't factor into that. Like, you don't need to feel guilty to realize you've done something bad, feel bad about it, and then try to do something about it. There's some, yeah, guilt and shame. Yeah, maybe shame is the better word for what I don't like. There's something about like this feeling people get that makes them feel like because they f***ed up, there's no point in them trying anymore, and that's like the most unproductive possible thing a person can do.
felt very much like there was just something wrong with me. And I was just trying to figure it out. And I used the internet to help me do that. That's where I felt like I could diagnose myself. My favorite websites were YouTube and Tumblr.
I really love this whole.
It's such a huge amount of content that I consumed at that time. I mean, I watched a lot of
This is also how people fall into ISIS.
Trans people. I watched a lot of, gender transformation videos and saw these people really just like go from female to male.
Being happy. What you're seeing here is trans people being happy, which is something that conservative hate groups don't typically want you to see. There are lots of happy trans people. There are lots of whiny, mopey, depressed trans people, but I've met lots of happy, whiny, depressed, not trans people. I think that's just a universal component of the human experience. Also, trans people have more reasons than most to be depressive, considering the whole hate movement thing going against them. Not really an anti-cis hate movement, and cis people still somehow find ways to be depressive sometimes. Going online, conservatives, when they argue that happy trans people posting their stuff online is grooming, what they're arguing against is social degeneracy. The argument, which is made by a lot of conservative demagogues, is that even the mere social presence of trans people is a pollutant that infects the minds of young, vulnerable people. This rhetoric is ideologically indistinguishable from what the Nazis believed about basically every reactionary tendency they had. It's not even a comparison, it's just the same thing. Conservatives believe that trans people is a social contagion, that trans joy is a social contagion, and the Nazis believed identically, like the exact same thing with no differences whatsoever. So it's good to keep that in mind.
Visually, like they looked like men, and I was like, whoa, I didn't even know that it was possible for a woman to pass as a man that well. It's really dark when you think about it, because the people who are consuming this are children, like 13, 14, 15.
I don't think that's dark. I don't think it's dark for 13, 14-year-olds to go online and see people being happy in their skin. I think that's fine, actually.
15 years old, and it's so easy for them to literally be groomed. I just started looking into all of it. I was like, oh.
Again, remember, this individual we're listening to right now is literally the victim of Christian conservative grooming to suppress their trans identity. They're literally Twitter posting about how they still hate themselves and they dream of being a man. Like, they're, as is so often the case, every accusation is a confession. Conversion therapy is literally grooming on an institutional level. Hey, my child has independently arrived at this identity, this feeling about themselves. I will now, engage, I will now literally, pay a counselor to groom them into a different one, Every accusation is a confession.
Oh, so there's genderqueer, gender fluid, there's agender, there's you can be a demi-girl, which is when you're 90% girl, 10% not girl.
None of these terms really mean anything, to be honest. You can ask different people and they mean different things. It's kind of like asking people about horoscope shit,
There's just an infinite amount of ways that you can interpret and express your own gender identity, and your gender identity is
Cool. Sounds like freedom.
who you are, and nobody gets to take that away from you.
Yeah, well, no, I like how this is being framed as a scary thing when they're literally saying like, yeah, there's so many ways you can express yourself and no one can take that from you, which is like something you would hear in a Disney film, but it's got like spooky music. It's like the trans community wants you to believe that you should be yourself and be happy, you know?
So hearing that, I just became very, very interested in having a male persona.
Conservatives are terrified of free expression. Yes, they are. Absolutely petrified. That's why conservatives are always telling you what men should be and what men should do. Why, like, you know, civilizations die when you don't pass down the art of manliness. Men now are nothing like they were 100 years ago, who are nothing like they were 1,000 years ago, who are nothing like they were 1,000 years before that. Same with women. Everything changes. Nothing stays the same. It's all culture. It's all free-flowing. Be the best person you can. If you want to be a dude, a woman, whatever else, go for it. As long as you're not hurting other people, go for it. Maybe you'll make some mistakes along the way. That's part of life. That's going to happen to anyone and everyone. I've made mistakes in like my expression of identity. I used to wear exclusively like anime graphic design t-shirts. Now I don't. I made a mistake. It took me till I was 29 to correct it.
The more time I spent online, the more it felt like real life.
I had a man
the more
bun.
real it felt, which eventually led to me just fully transitioning.
Cool.
So,
and they still dream of being a man.
I came out to my parents as Ollie, and, you know, I went to this, I guess, behavioral mental health clinic for like 6 days. They had a meeting with my parents, and they basically told my parents that if you don't validate Oliver, if you don't validate him, then this is just going to get worse.
First of all, you really shouldn't take anything that they have to say on the clinical medical process at face value, because they have every reason to lie. However, in this specific case, that's actually good medical practice. The reason for that is because if your psychological assessment of a trans person begins with denying their identity, it's actually really unproductive. Genuinely, it doesn't lead to good outcomes. The best outcome that you could get, from what I understand from the medical literature, and this is verified like in all over the world, not just the United States. This is like, there are plenty of medical associations that agree on this. This affirmation approach towards people, like trans people in clinics, is accept the identity they say they are, and then try to get to the heart of it. So maybe they also have depression or anxiety, or maybe they're also autistic. You can talk about that, but don't argue with them. Like, imagine if a person realized they were gay and they wanted resources and help with that. Like, and the first thing you would do is try to like debate them on whether they're actually gay. What are they even supposed to say? Like, what do they do? Suck a cock in front of you? Like, what, like, how is a person supposed to prove their gender identity to you if you're going to question it? Like, you're like, no, you're actually a woman. You have a womb and a pussy. And they're like, I know that, but I feel like I'm a guy. And then they're like, yeah, but you're not. And they're like, okay, what are we achieving here? What are we accomplishing? Conservatives are mad that gender clinics aren't just like doctors telling trans kids that they're not trans. They want gender clinics to just be conversion therapy.
The best thing that you can do to help him is to accept him.
What about depression? Just debate for them to be happy? Literally, like the equivalent of what they're advocating for would be for somebody to go into a clinic saying they're depressed, and for the therapist to be like, first of all, no, you're not. Like, that's literally the equivalent of what they're doing here. Like, obviously what you do is you say, okay, so you're depressed. Let's talk about that. How do you feel? Why do you feel these ways? Let's get to the root of these feelings. You can do that. That's cool.
As your son. But I already felt like I wasn't what my mom had expected. And for me, transitioning was the closest I could come to killing myself without actually doing it.
Why? Let's unpack that. Why? I hope you elaborate on that statement, because that's an odd one.
With all of these mental struggles that I was having, not knowing how to make sense of it on my own, and consuming so much of the trans narrative
and just loving life.
Hearing
the trans narrative shows a hot guy saying, I'm loving life. Thank you, Prager U. I appreciate you actually showcasing trans joy. Normally, Prager U will only show like screaming blue hair, whatever trans people, you know. So it's nice to just be like, ah, well, here's the trans community, and they look good.
People say this made me so much happier. This alleviated my pain.
Spooky.
I wanted to alleviate my pain. I also didn't want to be who I was. So...
Okay, so by suicide, you mean changing yourself? Like you were killing the girl part of you, but being reborn as a guy? I want to know what they mean with like, it was the closest thing I could do to suicide, because I like, that doesn't track unless it's like the death of the woman and the making of the guy. I don't know.
With transitioning, I could do both of those things. I could alleviate my pain and I can become someone else.
Okay.
I wanted to escape my own identity as Daisy.
That's fine. That's not so I felt depressive, and I felt the only way out of my depression and my self-hatred was to change who I was. Okay? All right? Is that I don't think that's a bad thing. Like, are we fear-mongering on the concept of self-improvement? Probably.
My name is Ali Chadra, and this is my voice.
Chadra. Hell yeah.
One day before testosterone.
I think they meant the most extreme way of stopping the pain other than suicide. Yeah, but that's medicine. Like, I feel enormous suffering and I have two paths before me: kill myself or get better. And they're fear-mongering about the get better part. Like the get better path is the one that is currently being lambasted.
That was really the...
Yeah. Kill myself or take Advil.
Beginning. I wasn't just playing around anymore. I wasn't just playing dress up anymore. Like, I was actually going to become a trans man and live my life that way.
Cool. Popeye.
Culturally, we are
Oh,
Mexican.
new character?
And men have to be very masculine in our culture. And I wasn't the most masculine growing up, and I think that had a part on everything that eventually led me to do what I did.
See, get it? He's looking at Popeye because Popeye is like the archetypically masculine character. So this is like, he's like, gender.
It was around middle school. I was surfing YouTube one day, and a video popped up, male to female, and that eventually planted the seeds of doubt. It allowed me to be caught by the ideology that eventually led me to...
Caught by the ideology. Again, he's literally referring to saw something while searching for it. Like, this is what I mean by social contagion, like the Nazi theory about degeneracy and trans people. The like, by even knowing something. Okay, listen, I'm just going to say this, dog. If even knowing trans people exists is enough to make you want to be trans, that's on you. I'm really sorry, dude. I know trans people exist and I'm not trans. The idea, like, it would be one thing if they were like, okay, I'm going to be like really charitable to fascists for a second, okay? I'm going to say this, all right? This happens to literally all ideologies, so this is not specific to trans people. But the only instance of the quote-unquote trans ideology grooming shit that I could actually consider to be grooming is, and again, this is not a real problem, this doesn't happen that often, but it's when you have people online who are hardline advocates for a given ideology, whether that be Nazism, fascism, communism, transgender ideology, whatever, that will deliberately find depressive people and try to do this whole, like, this is the solution to all your problems things. The problem is, the only concerted and systemic variant of this approach that I've ever seen is incels being groomed into the far right. That was done on an institutional level. Like, money went into it. Christians do it all the time. Christians do it to their kids, the pedos. Are there some people online who are disingenuously overstating or misrepresenting transness to try to like pull young people in because they themselves feel like they're helping? They're being like an advocate. They're being a proselytizer. Does that happen at all? Sure. I mean, at all. There are hundreds of millions of people in the United States. Like, yeah. But is this a systemic problem? No, it's not. And every effort to make it sound like it has been has fallen flat. There are weirdos online. I don't deny this. But I think it's telling that in this quote-unquote documentary, all they're saying is, we saw trans people online. To them, getting groomed into the ideology, all it takes is seeing it. That's not what grooming is. If they were to say, hey, there was like a really weird upperclassman who was trans, who was like kind of like weirdly pushing this on me, and they were trying to sell, like, my parents divorced and they were trying to sell me this like solution to my problem, blah, blah. Like, if there was some sob story like that, I would feel pretty bad for them, because I do think that's really to the extent that that does happen. But that's not what they're talking about, is it? What they're talking about is merely seeing trans people being happy. Again, this is indistinguishable from Nazi rhetoric.
Hurt myself.
Wait, what was the...
And that eventually planted the seeds of doubt. It allowed me to be caught by the ideology that eventually led me to hurt myself.
Okay, so by hurt myself, they meant transition. Okay.
Eventually, I just wanted an answer to be given to me on who I was, and I went to see a therapist. And
I think one of the most extreme and straightforward examples of this particular element of Nazi social degeneracy theory that I've had on stream is when I debated Alex Stein, and he unironically argued that men in public with long hair could cause gender confusion in children who see them, and that could also be a social contagion. He was saying, like, the contagion is so virulent and so powerful that even having longer hair as a man, something Jesus Christ had, could constitute like a kind of grooming. It's which I don't even think he actually believed that, because Alex Stein is like a troll. But I think it's kind of telling that that's what they have to bite the bullet on in order to be consistent. Yeah, he also said he saw a drag queen once as a kid and it confused him. So, you know.
I had only asked, I think I might be trans. I don't know. I want to know. The therapist immediately on my first appointment with her said, yes, I am a transgender woman. She had my letter to transition the same appointment.
Okay. So, first of all, you can't go to a therapist and ask them if you're trans. They don't know. What it sounds like happened, and what I'm guessing happened, is they went to a psychiatrist or psychologist and wanted to ask questions about their feelings and their identity. And after an appointment, the psychologist was like, yeah, the way you're behaving and the questions you're asking make me feel like there's probably a decent shot that you are a trans woman. And then gave them a follow-up appointment. Is that so bad? Like, what did you go to them for? We can't know the content or the details of that particular interaction, but that's not necessarily sinister.
After that, I just took everything slowly.
Okay.
But
love these long, lingering, scary shots, like multiple minutes of them before anything even remotely allegedly sinister has happened. Like we're still on like the opening establishing bit of the story, and it's like this guy's in fucking like back rooms or something.
Eventually my father found out what I was doing, and due to our culture, he was not happy, and he took me to Mexico and had me have sexual relationship against my will.
Okay, so we have our first instance of actual grooming and sexual abuse, and it's from a Christian conservative, not from the Okay, well, this documentary is failing to make the point that it was trying to make, just a little bit. Okay, all right, well, I guess now we have a villain for this script. Jesus. Yeah, PragerU was like, what a responsible father.
was a prostitute. I was a 19-year-old kid, and my father told the prostitute, take good care of him, it's his first time. He was trying to prove that I was a man. That broke me, obviously.
Okay, again, like, holy shit. Like, this is supposed to be about how this is supposed to be about how trans is how is the emotional thrust of this about how being trans is harmful when this is included in the script? Jesus Christ. What point do they think they're making? Holy shit. Almost like conservative overreactions to trans children does infinitely more harm than actually being trans. Like, that's... Dude, I feel like I could just end the video right here. The video's over. Are you fucking kidding me? Like, everything that I've been saying, just right here. Like, what... Like, people are gonna watch this video and be like, yes, this is why we need conversion therapy to convince trans children they're not actually trans. After listening to that.
After that, I go back to the therapist and told her I wanted to transition.
Oh, well, I guess conversion therapy doesn't work.
And she recommended I start my social and medical intervention as soon as I can. 11.
That's the really spooky part, is like, yeah, my dad had me by a prostitute. Then I went back to my therapist, and my therapist got me on E. And like the lightning crashes in the background.
Months after I had started hormones, I was transferred to another medical professional who, after speaking with him for one time only, he approved me for surgery.
Okay. Wait, surgery? What surgery? Breast implants? You can get breast implants pretty easy. Breast implants are like a relatively well-developed, like simple... Well, I don't want to say they're simple. Whatever, just,
And a few weeks after that session...
Oh, yeah, breast implants. There we go.
I got 2 letters from my insurance approving me for surgery. But I was a little surprised that I received my letter for bottom surgery, which was removal of my genitals.
You are an adult. You have a right to get the medical procedures done that you want done. You were 19. When I was 19, I could get basically any cosmetic medical procedure that I wanted done. People argue over whether or not bottom surgery is cosmetic. It's obviously not just cosmetic, but I'm just saying, like, in terms of alterations to your body or whatever, like, if you want surgeries to do this, that, the other, like, you're an adult, you know? Like that, yeah, that's how it works. Yeah, it's not the removal of genitals. They make the genitals do a loop-de-loop, basically. Very, very, very complicated. They call it butchery, and it's like the most intricate, precise, complicated, little thing. It does a little flippy, yeah.
Without even asking.
What? Wait, what?
Me for surgery. But I was a little surprised that I received my letter for bottom surgery, which was removal of my genitals without even asking.
Oh, so you went in to a doctor and started pursuing medical, like surgical transition, and they just gave you an approval letter without you asking? Is that, you can say no? They didn't do the surgery without asking. They gave you the option to do the surgery. You can say no.
My name is Ali Chadra.
Oh, we're back.
This is my
we're switching. We're doing a documentary thing. We're switching.
My voice pre-T. My name is Ali Chadra, and this is my voice 1 month on T.
2 days ago was my official 3 months on testosterone.
You ever seen one of those trans guy, like trans vlogs or whatever, where they're like, here's me 1 day before T, and then the next day they're like, all right, here's me after 1 day of T. I know, I'm surprised too. This stuff really kicks. Holy shit, is that Scott the Woz? Yeah.
This is my voice 4 months on T. It's probably not really a good thing that I was able to get my hormones so easily.
No, it's fine. This is self-hatred talking. I'm sorry. What the fuck are you doing? You're actively transitioning and you're like, yeah, I think that there should have been more arbitrary medical gatekeeping that only applies to trans people and not other groups.
I mean, anyone can go in there.
Not only
did
that's how medicine's supposed to work. You go to a doc and the doc gives you a consult and a referral. That's how all medicine works. That's how it works. That's how it works. That's how it's supposed to work.
Send me home with the hormones, but I actually did my very first shot right there in the doctor's office, and I was just euphoric, and it was real, and I was actually going to start seeing changes, and I was going to start passing, which basically meant that everyone around me was going to see me as a boy, an actual boy. This feels good. This makes me happy. I'm actually feeling the feelings that, you know, all those like trans people online were saying that they felt.
Really arguing against trans people right now. Really selling the idea that transitioning is always harmful right now.
I just want to say that I'm literally so happy with my chest. It's so much better than I thought it would be.
Wait, no offense is trans? Yes? Oh.
Seemingly out of nowhere, we've suddenly seen a huge spike in media depictions and social media depictions.
Harmeet K. Dillon. Let's learn a little more about this person, huh? We're about to hear more social contagion degeneracy theory. An American lawyer and, wow, Republican Party official. Detransitioning case. Dillon's firm filed a lawsuit against Kaiser Permanente over misinforming and medical damage experienced by 18-year-old detransitioner Chloe Cole of Central Valley, California. As California legally permits gender-affirming surgery for minors, Cole had a double mastectomy at age 15. The suit was preceded by a letter of intent to sue addressed by Kaiser, a named endocrinologist, a named psychiatrist, a named plastic surgeon, claims that Cole is suffering from ongoing deleterious health effects from off-label use of prescription drugs. Cole says she was not properly informed as to potential negative effects of puberty blockers and testosterone she was given at age 13. The lawsuit claims that Cole did not give informed consent. She was under extreme duress to accede to the medical treatments. And a legal advisor to the Trump 2020 campaign, so you know how trustworthy this individual is. Without knowing more about the case, I can't really speak to it. It seems like what was done was legal. If the only claim is that Chloe Cole was subjected to duress and not informed as to the potential negative effects, that's almost certainly like a he said, she said, right? Like that, like I don't know how much could even be substantiated there. So there's not really much that I can say on that. But okay, we have a person who belongs to a Republican Party official who belongs to a law firm that is directly profiting from anti-trans hysteria.
Media depictions and social media depictions of transgenderism. It's even reached the mainstream advertising world. And I think that
yes, trans people exist and therefore can also be in advertisements.
this is all coming to a head and what this really means for our society. In cases like the case of Layla Jane, a young girl whose breasts were removed
oh, well, here we go.
At age 13 by doctors who fed her a lie.
Take this next case. Layla Jane was born a girl.
Layla Jane experienced a host of medical issues in her youth. Her mother, who is bipolar, expressed to the...
I like how they say a host of medical issues, like highlighting anxiety, depression, and then they highlight exposure to online personalities, the other disease, you know? Doctors don't want you to know about this one.
These physicians and therapists that her daughter might be bipolar, but she actually never received any diagnosis or treatment for that. The family went to one physician who, after less than a 2-hour appointment, green-lighted the hormone therapy.
Okay. All right. The idea that you can't transition if you have mental illnesses when being a closeted trans person is the cause of many mental illnesses is insane. Like, okay. Like, so, all right. So they saw that their child had some mental health issues and then they went ahead with the transitioning. Like, what's the issue here?
And in a similarly or even shorter period of time, a plastic surgeon signed off after one visit on removing her breasts.
Yeah? It's a plastic surgeon. Why would they need more than one visit? What is a plastic surgeon supposed to do with the second visit? Like, a plastic surgeon, like, looks at you, says, yep, those are breasts, and then, like, what do they... What would the second visit from the plastic surgeon do? Also, notice how they're completely destroying the agency of the parents here. The parents would have been involved in this process. It's not like the doctors showed up at their house and did a double mastectomy in the dead of night. Like, the parents brought them to these appointments, signed off on this, and now they're crying about it.
Like most young women who go down this path of identifying transgenderism as the solution to their problems, reinforced by irresponsible medical care providers, it's like
no evidence provided of irresponsible behavior, literally just them doing their job.
Likely that if physicians had properly diagnosed all of the issues present in Layla Jane as a child, she would never have gone down this path.
That's not the responsibility of the gender clinic. The gender therapist's job is not to go, oh, hold on, you need to do all these other things first. You have to fill this checklist first, and only then can I give my medical assessment on whether or not this individual may or may not be trans. That's not their job. You went to them, you asked them, they told you. You, as a person searching for medical care, have to exercise responsibility over the decisions you make in seeking care. That's up to you. You have agency there. It is the responsibility of the doctors to make assessments as best as they can and to be honest and forthcoming about recommended procedures and treatments and the different paths that you can take. And unless there's evidence they failed to do that, and sometimes doctors do fail to do that, don't get me wrong, but bad doctor is not exactly a gender clinic specific concern. That's just a thing that happens. Then you don't really have anything.
When parents of trans-identified kids are referred to specialized gender clinics, they're often told that they're going to get comprehensive, multidisciplinary mental health assessments. We know that that's not true. In practice, these kids were put on a fast track to medical transition.
Layla is now 18 and is fighting back. So this...
I mean, I can't really debunk him saying they said this, but they didn't. Like, I don't know.
Does not happen to anyone else.
My name is Prisha Mosley. I was a 15-year-old girl when the trans community found me.
Again, this is why it's so difficult to take seriously anything they say, because the way they express their concerns, it's never like there's something serious happened. They have this well-reasoned set of arguments to explain and define it. It's always this insane fear-mongering bullshit. Like they all got paid off by conservative orgs to say this stuff. The framing is so clownish, you know? Like, yes, I was hiding from the trans community under the desk, but then they turned the corner and found me, like the Terminator robot, you know?
Already diagnosed with multiple mental illnesses, including anorexia, a body dysmorphic disorder, and borderline personality disorder, a trauma disorder, I was easy to manipulate and convince that I had been born in the wrong body.
Then how are you manipulated and convinced? If by manipulated and convinced what you mean is you saw posts online, you thought, oh, hey, that could be literally me, then went to a gender clinic and said, hey, I think I might be trans, and they talked about it for a bit, and then you got approval, that's not you being groomed into it. That was your idea. What do you...
I was told that this was the reason for all of my mental and emotional distress.
Gender special.
I doubt they said that. Again, it's like, let me believe the testimony of somebody who unironically made the statement, the trans community found me. I don't think that's the case. I think it's more likely that a doctor would say there is a good likelihood that like you are trans and that your problems are being exacerbated by that. But these guys have an incentive to overstate the case because they're trying to pretend that like it's all a big grooming scheme. Please remember that so far the only substantial negative thing that has happened in this video and has been described in this video was a conservative parent having their child as a way of like correcting their alleged transness. That is the only thing in this video thus far that has actually been like a clear moral harm, and it was by the people on the side of PragerU. I don't know why they would include that. They should have edited that out, frankly. It's not like they're averse to lying. They should have not included that in the final cut of this. I have no idea why they did. Anyway, also worth remembering, medical transition has an exceedingly low regret rate by every metric that we have. Lower regret rate than a bunch of conventional medical procedures. People overstating the rate of detransitions. A big, spooky dumb. It's very dumb. Big dumb. Low IQ. Small brain. Clunk clunk.
Specialist I was taken to see told my parents that I needed to be put on puberty blocking drugs right away. They asked my parents a simple question: would you rather have a dead daughter or a living transgender son? This was the moment that we all became victims of so-called gender-affirming care.
But is this the document we're talking about? You needed this letter signed by a therapist to open up the door for you to get these medical treatment. Is this the document that we're talking about earlier?
Yes, it is.
And it took you how long to get this?
Oh, 30 minutes.
Okay. Again, I can get a referral from my doctor pretty quickly too. I don't know what the point they're trying to make is. Like, yeah, you go to a doctor and you ask for a referral and you get a referral. You go there and you describe a problem that you're having and they're like, damn, that sucks. Want me to like refer you to a place that'll charge you $300,000 for it? And you're like, yep, I would love to go into debt for that practice, sir. Thank you, sir. And then they give you the referral. Vaush, I regret getting my wisdom teeth taken out. I didn't need to do it. I had complications after. I didn't regret any of my trans surgeries. Yeah. Literally, like, they never want to talk about the regret rate. The only quote unquote regret rate that conservatives will refer to is that one bullshit paper where they were like, actually, there's a 97% desistance rate. And what they were actually looking for was, we found that many young boys who at one point picked up a Barbie doll, then set it down, did not go on to get like a breast stapled onto their chest. Therefore, these people detransitioned. The desistance rate from their early trans behavior did not persist into adulthood, which is like total bullshit. Like, they are deliberately making up new terms and statistics in order to conflate them with the detransition rate. But anyway.
Ideology that has become dominant at these clinics is that trans kids know who they are, and therefore to question them, to ask basic therapeutic questions like, could your gender dysphoria or gender identity have been triggered by some other event in your life? Basic questions.
Why would a therapist ask that question? Why would a therapist ask, hey, this thing you think you are, what if it's actually from some trauma? Like, if a kid came in and wanted therapy because they were struggling with being gay, and the therapist is like, what if you're gay from some sort of abuse in your past? Who would do that? The ideology that they're referring to, gender-affirming care, is just the same strategy that therapists use for all issues and matters of identity. It's gender-affirming care isn't even like a specific thing to trans people. It's literally just the way you are supposed to manage people coming to you with those kinds of issues or questions. Also, even if your gender dysphoria was caused by something in the past, like, does that mean it shouldn't, like, does that mean it's invalid? Like, what do you mean? Like, we don't know where depression comes from. Sometimes it's genetic, sometimes it seems to be caused by an event. Like, that doesn't really change whether or not you would try to treat it. Don't you think it's irresponsible to promote heart surgeries if people might regret it? I mean, people sometimes do regret heart surgeries. I'm not sure what you mean. But also, if you go to a doctor and you describe having heart issues, and they refer you, like, that's how it works. It was a joke? Okay.
Of screening are completely taboo in these circles. But the truth is that parents don't have much of a choice in the matter, and doctors are telling parents in front of their distressed children.
Parents have complete say in the matter, actually. They literally do all of this. They bring the children to the meetings, they schedule them, they manage it through their insurance, the parents have to sign off. It's complete parental control over all of it. Just making it up.
If you don't consent to the use of puberty blockers and cross-sex hormones, your child is going to die by suicide.
That is not what therapists say. It's just an absolute lie. They might say that there is a suicide risk, which is true, but they are not saying like it's a 1-to-1. That's ridiculous. Also, like, why, if you bring a child to a therapist and the therapist said, oh, your child has depression, I think that SSRIs would be good for them, or like lithium for mood stabilizers, and the parent for some weird reason was like, no, I don't want to do that, would it be bad of the therapist to say like, hey, you can choose between your child having these meds or potentially your child having worse mental health outcomes? That choice is yours, but I don't know why you would choose the latter. That's pretty normal.
I believe that most doctors who practice gender-affirming medicine,
Their gender dysphoria.
they genuinely, sincerely believe that they're doing good, but they're not.
Finland, Sweden,
Despite having lower regret rates than basically any other medical procedure.
France, Norway, and the UK are reversing course and asking questions.
Have all not found enough medical evidence, psychological evidence, to support transgender therapy.
In the UK,
These are lies. Through political pressure, the NHS walked back on some of their medically valid practices concerning trans people. And since then, the sort of wave of conservative backlash has led to politicians stopping doctors from doing what they need to do to keep kids safe and healthy. This like backlash, this shift in policy has not come from doctors. I mean, if it's just from conservative politicians, then what kind of argument is that? That's literally just saying like, trans care is bad because we've said trans care is bad.
their only national gender clinic for children shut down last year by court order. What do their doctors know that our doctors don't?
Part of the problem is that the current...
They don't. The doctors at the NHS, that wasn't a turnabout from them. The doctors did not change. Notice how he literally just said a court order shut it down. What do their doctors know? Dog, the doctors didn't shut it down. The court did. Why are you pretending that the doctors over in the UK like had a turnabout when it was the court that shut them down?
Cohort of teenagers that are being transitioned under the affirmative protocol, which lacks guardrails, which takes kids at their word when they say I'm trans, which doesn't...
That's how all therapy works. Also, it doesn't lack guardrails. It tends to be quite restrictive. There are still restrictions on trans medical care that are not in place for a wide variety of other forms of medical care.
Do proper mental health assessments. In fact, double mastectomies on teenage girls went up 13-fold between 2013 and 2020.
Well, we invented trans people, so obviously they would go up, yeah.
Between 2016 and 2019 alone, these procedures went up by 500%.
A total of 209 patients underwent gender-affirming mastectomy between January 1st, 2013 and July 31st, 2020. Gotcha. This is literally the left-hand thing, I'm dying. Yep, exact same thing. Wow, we invented trans people, and then it turns out now that it's socially acceptable to be trans, more people are trans? That's crazy.
A study published in 2022 by researchers who are advocates of gender-affirming surgery.
Yeah, honestly, 200 sounds like way too small. Am I misreading this number?
13 and 2020. Between 2016 and 2019 alone.
No, it says right there, a total of 209 patients underwent gender-affirming... Okay, I think this is the same paper that they're about to cite. There are over 150,000 transgender adolescents in the United States. Research and outcome, da-da-da-da-da. Okay. The incidence of gender-affirming mastectomy increased 13-fold. Yeah, this is literally what we're looking at. Of the 209 patients who underwent surgery, the median age of referral was 16 years. Is that really it? But, oh, I bet you they're not going to show this. Between 2013 and 2020, we observe a marked increase in gender-affirming mastectomies in adolescents. The prevalence of surgical complications was low, and of over 200 adolescents who underwent surgery, only 2 expressed regret. Neither of which underwent. That's a 1% regret rate, which is like 1/7 the regret rate for knee surgery. Cut the tape. Don't show this. Our study provides useful and positive guidance for adolescent parents or adolescent patients, their families, and providers regarding favorable outcomes with gender-affirming mastectomy. Oh, damn. Turns out, as is always the case with PragerU, you look up the study that they're selectively citing from, and it turns out they say the exact opposite of what the PragerU video says.
These procedures went up by 500%.
2 cases of regret in 7 years.
A study published in 2022 by researchers who are advocates of gender-affirming surgeries showed that the youngest patient to have received a radical bilateral mastectomy in the United States is 12 years old. These kids...
Damn, that's crazy. Good thing it's not my job as a political commentator to investigate the specific details of every single surgery ever conducted by every doctor in the United States. let's politicize and make national issues of like, hey, in 7 years we found 200 cases and here's on the low end. Like, yeah, let's make everything congressional inquiry, you know? I mean, earlier in this video, the dad of one of the documentary subjects said that he had his son put in for corrective rape. Let's not examine that, you know?
Are going to grow up and they're going to start to feel the full effects of their medical decisions. They're going to start to feel the side effects.
Oh, damn shame that the article that you looked at, the study that you looked at, said only 1% of the people who had engaged in adolescent mastectomies experienced regret. 200 cases over 7 years, and of those, only 2 expressed regret.
If you really want to know whether amputating the breasts of a 12 or 13-year-old girl is ultimately in her best long-term interest.
Hold on. I wonder, yeah, they're even lying about this. Of the 209 patients who underwent surgery, the median age at referral was 16, ranged 12 to 17. So this refers to referral, not the actual surgery. I don't know if the actual surgery would have been done immediately after or if it would have waited a while. I'm not sure. It's possible for referrals to like keep for a while before the actual surgery. So yeah, like dishonesty at like every level all the time. If you in any way, shape, or form agree with the content of this PragerU hit piece, why do they have to lie all the time?
Ask her when she's 30 or 40 and unable to breastfeed her own child.
Yeah, dude. Go to a 30 or 40-year-old trans guy who's been living as a man for 20 to 30 years and be like, I know you spent the past several decades living as a male, but do you now regret not breastfeeding, a thing you definitely want to do? Do you feel, so, excuse me, sir, sir, this is like going up to like, hey, being a trans chick might sound cool when you're young, but go up to a 40-year-old trans woman and ask them if they, you know, if they miss being able to like, I don't know, crush a brewski against their head while like impregnating lots of it. Like, what do you, like, they signed up for this. How do I feel that I can't breastfeed my child? You know, I think I'll live. All right. Little personal here, but I guess they signed off on it for the documentary, so. Oh wow, they look really happy. That's really defeating the trans agenda right there. How they see the titless, breastless torso, and they seem really happy. That, ah man, I'm feeling really anti-trans right now.
I would go out into the world and...
As opposed to, by the way, how our documentary subject looks and has admitted to being miserable right now. Literally on Twitter being like, I don't want anyone who watched the documentary from PragerU believing that I'm happy. I'm not. I'm miserable every day. I dream of being a man. And then like in the documentary, they're like so monotone and sad.
Everyone's calling me Ollie. Everyone sees me as a guy. But then, at the end of the day, when I'm home, in my room, looking in the mirror, I'm like, what did I do? Like, I start getting these, like...
Christian guilt. I refuse to accept any other explanation.
Really scary thoughts of, like, you're incomplete. You're not a guy. You never will be. But even though you're legally... You know, your driver's license says you're a guy, you know you're not. You finally...
So, yeah, they're literally just describing dysphoria, but it's dysphoria that's also being motivated by like Christian guilt. They're literally like, I still fantasize about being a guy all the time. Jesus Christ is my only hope. Like, this is beyond parody. Literally, I didn't paraphrase in case you're not looking at the screen. Quote from Daisy Strongen's Twitter account. Transition still plagues me today. I fantasize about being guy at least a few times a week. I'm often a guy in my dreams, but now I know I can't indulge in those fantasies. I have to be the best mother/wife I can be. Jesus Christ is my only hope. He is your only hope too. They've been groomed. They seem so happy now that they've left the trans cult. I still deal with self-loathing. I'm still sick of being me. Like, yeah, they're doing so good. I remember watching Daisy back when they were trans in 2016. Oh, really? They loved Jordan Peterson. She definitely had a lot of religious trauma. Really? So even back then, as a trans guy, living as a guy, they were still like hardcore fucking groomed by conservative ideology. It, again, remember, never forget, okay? Every accusation is a confession. They say that Daisy was groomed by the trans cult. All Daisy had to do was see trans people online being happy. Look at the joy that they felt seeing themselves after top surgery. That's real. But it took years of Christian shaming and conservative dogma to make them hate themselves enough to go back in the closet. That's the grooming.
Have expressed your true inner self or whatever, the thing that you wanted to do so badly ever since you were like 13, 14 years old. You did this thing to alleviate this gender dysphoria, you know, that wasn't there before, but you made it into a problem, and now your body image issues are—
It wasn't there. Wait, you saw trans people online and then began vividly fantasizing about yourself as a man, but it wasn't there before. What? Like, oh, this is the trans equivalent of a guy who thinks he's straight and is the most. This is literally like Mac from It's Always Sunny, where everyone in the gang knows that he's gay, and he's like, oh, whoa, you know, he's like, these guys, you know, I wasn't feeling gay before, but then I saw this, and like, it's literally like everyone's like, dude, just fuck him, just suck cock, come on.
worse. That's not supposed to happen. What do we do now?
I just woke up one day, looked at myself in the mirror, and asked myself, what the heck am I doing? As I realized, no matter if I would have gone every surgery, continue with hormones, I realized I would have never been a woman. At best, I would have been a caricature of what I believed a woman was.
Boy, I wonder if this person whose conservative father had him correctively raped in order to detrans him might also be subject to conservative grooming and you know, like self-hatred.
Nobody would help me because they had more concerns of me reversing everything. I just socially detransitioned, got the implants removed. So I had technically developed gynecomastia.
Say what you will, but this is an informative documentary. No kidding, dude. This documentary is unironically such a good argument for our side of things. The only point in this documentary that started to sound like a regular, like, conservative hit piece on trans people was when the two conservatives went on there and were like, yeah, let me just repeat all these talking points. But every single second that these detransers are on, they're making our arguments, like, so obviously. Like, this is practically a pro-trans video. Unironically, like, seriously, they briefly experienced joy as they got to be trans, but then their abusive conservative families dragged them back down into self-hatred and dysphoria. Perfect. Sold. My argument. There we go. Jesus.
My chest is not like it used to be, and it never will. I have scars.
They just showed your chest. It looks. I mean, you've got scars, but like, okay.
Numbness, and unfortunately my nipples are completely different, to put it lightly. It has been taking a major toll on me since I realized what I've done.
I was almost 5 years on testosterone, so if I had gone further, I wouldn't have been able to go back.
Conservatives, hormones are irreversible. They destroy your body irreversibly. Also conservatives, yeah, I was on testosterone for 5 years and now I look and sound like a cisgender woman. Dude, 5 years? And I thought you were on it for like 6 months. Dude, hormones will ruin you. You'll never go back. And then like, dude, what the fuck? You had a kid. You look and sound like a cis woman. You've had a kid. What do you mean? You so much for irreversible sterilization. Jesus.
When I found out I was pregnant,
if I had only stayed on testosterone for another 40 years, it might have been too late for me.
It was just over the moon. I mean, I was scared I was gonna have a doctor tell me that, like, sorry, you're infertile, and it would have been my fault. There are so many young people who are going through very similar things that I did.
I'm really sorry. I'm taking a low blow with this one, but
Scared I was gonna have a doctor tell me that, like, sorry, you're infertile, and it would have been my fault. There are so many young people.
if you were showing me a documentary on like Christian women being groomed into a cult and made to hate themselves, this is the dress they would be wearing in the photo that the interviewer shows you before talking about how they died. Like, Jesus Christ.
Who are going through very similar things that I did and are still being told that transition will save them. And it's just not true. My story is tragic in some ways, but it's very redemptive in many ways.
Yeah, with all that self-hatred you still have and are tweeting about. Again, remember, my guess is that they tweeted this out in response to this portion of the documentary. Like, they're so miserable that there's a brief portion in here because Prager, you realized, like, we should probably show the detrans people being at least a little happy, right? And then they saw this and they were like, hold on, I don't want you to get any, like, bad impressions or whatever. I'm still miserable. It's like, dude, it's so miserable. It's so sad.
That cannot be said for many detransitioners. And that's just heartbreaking. Like, I can't imagine living with that. Like,
the most projection anyone has ever projected. What they're saying they can't imagine somebody living with, what they're referring to is dysphoria. Dysphoria that other trans guys have corrected or even gotten rid of by transitioning. Dysphoria that they mitigated by transitioning. Oh, is that true, Tempest? I thought that she wasn't able to. Nice.
I can't imagine what it would be like to regret a bottom surgery, or, you know, to be...
Good thing very few people regret bottom surgery.
Be infertile, because when you were a little child, like 12, your, you know, parents were manipulated into putting you, like, blocking your puberty.
So again, with the framing here, parents manipulated. Yes, this is a very real thing. That parents of 12-year-olds why would they, first of all, what, manipulating? Like what? Like subtle hints to trans their kid? Such an absurd, again, Nazi shit. The idea that, like, degenerate liberals infect the world by subjecting and blighting their children with, like, their propaganda. The only person who, from a young age, was raised and groomed into hurting themselves was you, and it was Christianity. Both of the detransitioners. Like, we're literally watching a documentary where the central theme is conservative grooming of children who briefly escape it and then get pulled back into it.
Being so young, I was so impressionable. I was told so many times
Jamie
it's possible
Gorel.
that you're trans, it's possible that you're trans, that eventually I started to believe it.
Unfortunately, transition made
Laura
things worse
Becker.
for me.
It has just kind of wrecked my perception of myself, and I feel like I missed out on like 3 years of my life. I missed out on 3 years of living my teenage girlhood.
I didn't realize that there were women like me who were different.
So, here's the deal.
I looked up the first name listed there under this, like, list of detransitioners that PragerU paid money to get their little testimony, and the Zozia Gorel thing, the first one, the first video that I saw here was I'm not sober anymore.
I'm detransitioning. It's true. It's not a joke.
I understand now that I can be a cis woman again. I haven't gone too far. I haven't passed the point of no return. I can live as a woman again.
I was something because
just a reminder that the reason why detransition oriented propaganda videos rely so much on testimonies is because it's really easy to get a bunch of testimonies when you're paying people for them. It's what is difficult is getting good, like, statistical data to support your case, which is why the one study that was shown in this documentary supported my point, but they just didn't show it. Like, they just lied about what it said and then left it. It's very easy to get a series of testimonials. Do you want to find, like, hey, let's do a video. Let's find as many video testimonials as possible from happy trans people. You could make that video thousands of hours long. Hey, trans people who are happy that they're trans, send in 15-second video bit of you saying that you're happy with your being trans. Let's go. You wouldn't be able to fit the YouTube video in the upload. You wouldn't be able to. Wouldn't even fit. Never-ending video. Let's actually do it. I'm not managing it. Nope, that's not my job. Thank you. Like the point is testimonials are easy to get, especially when you're paying for them. I wouldn't have to pay, by the way, to get trans people to say they're happy. But there's a reason they're avoiding statistical data.
People were reacting to me, but it was a me that wasn't really me, so I was protected. I was protecting myself with the trans label.
You look so happy. You're doing so good, bestie. Queen, or should I say king, whenever you get back to it. You're doing so good.
These pediatric clinics that perform these surgeries, they will do nothing.
Hi! Hello! Speaking of people who were paid to be here, what's up? Hello, you freak.
To help these teens if they decide to detransition. There's nothing you can do. You know, once you've taken all those hormones, Billy, your body is changed beyond repair.
Except if you take T for 5 years, you can just stop and then be a cis woman and be fertile, and like it doesn't actually matter. I guess.
You don't have to remove your body parts to make you complete. When I transitioned, my suicidal ideation did not go away.
Transition is not the only answer, and there are many detransitioners like me out there.
My name is Camille Kiefel.
My name is Emily. My name is Laura Becker.
My name is Abel Garcia, and I'm a detransitioner.
My name is Daisy, and I am a woman.
I know I'm really kind of relying on people's preconceived biases here, but it really is quite funny how, like, almost all of the detransitioners who run the conservative grift circuit look miserable. Like, almost always, if they either like crash and burn a little bit after coming out as a detransition or conservative, or they say they're going back in transition, or they admit they haven't stopped transitioning and they've just socially detransitioned, but they're still medically transitioning, or they just look unhappy and have other issues. Like, it's just consistently, time and time again. Again, that doesn't mean detransitioning is always the wrong thing to do. It does mean that if you're the kind of person who detransitions and then goes on to make conservative grift content, you're probably detransitioning because of self-hatred more than anything. Nice. Well, this was the most well-produced pro-trans video I've ever seen. That's crazy. Okay, now having watched this, I don't think this is going to spark a new wave of transphobia among conservatives. However, among conservative trans people, this is probably going to cause some serious pain. Yeah, maybe. I mean, like, again, listen, I guess what I'm going to do now is I'm going to appeal to the you know, man's instinctive desire to not cuckold themselves, okay? And I'm going to talk to the conservative would-be detransitioner, okay? Don't be a cuck. Don't be a cuck. Don't be like those miserable, wretched who sell out their identity for a little bit of Prager dollary dues, okay? Don't do that. They're miserable, all right? Don't, these people, you have a fleeting grasp at happiness, and then you see, oh, I still feel dysphoric. You know, it's a complicated issue. Maybe it takes some time, but man, like these people, they are so transparently miserable. They're so unhappy. And I think that's just because a lot of them just never shook the self-hatred. Tempest earlier said that the main subject of this documentary, the one who still hates themselves, apparently would do like trans boy transition update videos with audio from Jordan Peterson lectures overlaid. And I have to say, you were already fucked if that's what you're on about. It literally doing T-boy updates on overlaid with Jordan Peterson audio. You're fucking done. It's already fucking done. So Jesus Christ, wild cognitive dissonance. Yeah, well, a lot of it is just self-hatred, you know. I guess so. The reminders here, the final takeaways for this video are every accusation is a confession from conservatives. The real groomers in this video are the conservative parents who over both of their trans children in this instance, one of them literally with corrective, something which just happened and then was not commented upon by the video because PragerU and people who like PragerU like corrective rape. They probably thought the dad made a good decision there. That's 2. And 3, like, it is very funny how they have to rely on testimonials and, you know, misrepresent the only study they can find because any like actual statistical data they try to find is going to end up supporting our cause. Just ridiculous. Just absolutely ridiculous. Oh, and the final takeaway is that this video is Nazi shit. The social contagion argument against trans people is and always has been just transparent Nazi ideology. It's not just regular conservatism. It's the idea that the mere existence of a minority group spreads a social disease that grooms and predates on young people. That is, again, when I say Nazi shit, I don't mean that's like the Nazis. I mean, you could take papers the Nazis wrote on homosexuals, translate it from German to English, and then replace homosexual with transgender, and it would just be the same things they say today with minimal changes to syntax or grammar or whatever. Nazis also hated trans people? Yes, they also did. Yes, same with trans people. Same with trans people. And conservatives did the same thing with homosexuals back in the 80s. And they'll do it again today. They will do it again today. 100% they will. The conservatives have been wanting to repeal the legality of gay marriage for a long time. They've been making the same arguments about gay people being innately groomers. They never stopped doing it. They just quieted down a bit when it became less socially acceptable. They would do the exact same thing.